An experiment in police reform in the shape of this white van. Carly Ceylon is a licensed social worker and addiction counselor with the Mental Health Center of Denver. She and paramedic Chase LINDQUIST are part of the city's new STAR program, Support Team Assisted Response.
Star one.
It's a pilot program that just happened to launch amid a pandemic and police protests.
What are the range of calls that you're seeing? Mental health, substance misuse, but really any self-identified crisis. You know, we could go to that and handle that more appropriately than an officer.
Instead of sending armed police officers, 911 dispatchers can send Carly and Chase to low-risk calls.
We're really looking at sending the right response when someone calls into 911 for help.
It's something that we need as a whole to help take the burden off of our system.
A study by an advocacy group found people with an untreated mental illness are 16 times more likely to be shot by police than those without one.
We are tasking police with jobs that are really outside of their realm. We've put a lot on law enforcement's plate that really belongs in the public health and I think like community resource realm.
Which is what you guys are.
Exactly. So we're trying to, I guess, right that historical wrong.
Rather than police trying to de-escalate a situation, this is escalation avoidance. No sirens or flashing lights, and first responders in street clothes.
There's a reason, Chase, that you're dressed like this.
Our goal was to try to look less threatening and more like a community resource, and so more of a community paramedic feel.
It's a basic thing, but does it help to be in jeans when you approach someone?
Oh, absolutely. You want to look approachable. You want people to feel comfortable.
It's a model that has a track record. For more than 3 decades, the Whitebird Clinic in Eugene, Oregon has run the CAHOOTS program. Social workers respond to nearly 1 in 5 emergency police calls there. Activist Roshan Bliss of the Denver Justice Project is fighting to reduce and fundamentally change policing as we know it. He and others in the community work to bring Oregon's CAHOOTS model to Denver.
Is the STAR van the first step in that kind of change?
Absolutely, it's a first step. There are many first steps, but we see the STAR program absolutely as a way to start stepping down society's reliance on armed and badged people addressing all of our problems.
He's had an unlikely but productive working relationship with the Denver chief of police, who also wanted to bring the Eugene idea to this larger, more diverse city because his officers are overtaxed.
This is a global movement that we're talking about here. It's a tipping point, and this is the time to re-examine, to reevaluate, and reimagine everything that we do.
Star 1 is available to respond.
As we rode along with Carly and Chase, they were called to help with a woman who was having delusions. We met up with them afterward.
We tried to build rapport and de-escalate the situation, and she ended up having to be transported to the hospital.
After nearly 100 calls in under a month, they're starting to build a reputation in Denver.
What have the reactions been like?
The guy that we transported last week who was like, who exactly are you guys and what is this? And got really positive feedback. He said, you know, this is really cool, this is comfortable, and I feel like you guys really helped me today.
For now, STAR is a few weeks into a 6-month pilot phase. The hope is to build more teams throughout Denver, become round the clock. Those in the field note, guys, that many 911 calls do still require an armed police response. 4 out of 5 calls in Eugene, for example. But reformers and police clearly agree that having this option helps. Savannah.
Yeah, and it's interesting to see the buy-in from the police as well. I know it's just in the pilot stage in Denver, but are other cities looking at this and thinking about doing something similar in their communities?
Yeah, absolutely. When we spoke to Police Chief Pazin in Denver and to Chris Hecht of the Whitebird Clinic in Eugene, they run the CAHOOTS program, they both said a number of cities, especially in the moment we're in right now, have been reaching out to them for more information, with questions about how to replicate this model.